Alright, it is Tuesday afternoon. I just left doing some rabbit surgery at Bayview, and now I rushed over to Social Veterinary Hospital, do a bird emergency over here. Anyway, as you look at this bird, that's where you want to sing one of those songs like which one of these is not like the other. Can you tell why this guy is here? Anyway, we've seen similar injuries, but the last time I saw one something like this, it was actually in a dog. Okay. If that makes any sense. Alright, so that's what we look like. We have lost some blood. I'm a little worried about anemia. We're breathing fine. We're just going to probably gas this guy down and then go ahead and cut that and remove it. We just haven't decided how we're going to cut it yet. So we're going to get him to the back. I'm going to towel him up and take him straight back there, and then we're going to get this procedure done in a hurry. Because the faster we are, the safer this guy is. Hey, you are cool though. You are so cool.
Do we need to do the introduction? So we're here at Social Vet Hospital.
I pretty much did that. Okay, that should be enough of that. While the guy's waking up, where's the rest of this thing? Yeah. Alright, so please you guys watching. This was poked out the jaw and into this. We actually went ahead and cut it. And once you got to cut it out of the way, we just pulled it out kind of like cutting a hook. And wow, that's got to hurt. Come on, little buddy. Wake up. Yeah, let me see inside your face. Yeah, that's going to heal up fine. He's going to get some antibiotics.
Can you see in there?
This could have lacerated his sublingual artery. Oh, yeah, wake up. Oh, yeah, big yawn. Okay, come on, buddy.
Hey.
Sorry, we did not glove. This was an emergency. We were in a hurry.
Hey, buddy.
Instruments were sterile. Suture was sterile. Everything else is good. And this guy's just a baby.
Hey.
Good boy. Yeah, good boy. You don't want to be red like them sissy girls. No, you're a pretty green bird. You're the color of money.
Oh,
Pretty colors.
Hey, you ready to lift your head? There you go. Oh, don't get crazy. Don't get crazy. You're doing good.
It's a snuggle.
We got you.
So sweet.
We got you. And yay, another happy ending. Oh. Hey, dude. Hey. So got a hangover now, Dad. All right, we're gonna send him home. We're gonna send home some antibiotics that you'll mix with the water. We're gonna choose this particular type. One, because it is labeled in birds and it's okay. Two, because when he actually drinks it and it goes inside of his mouth, it'll actually flush that hole just beneath his tongue, underneath his chin. I'm gonna show Dad. I'm gonna show Dad. No, don't you be getting all weird. If you look up underneath his chin, you'll actually see the suture. The suture is absorbable. Okay, so it can stay in there. But next Tuesday, if it looks like it's healed, we'll remove it then. Okay. Anyway, so we're gonna schedule this guy a recheck next Tuesday to make sure that hole inside the mouth is closed up. Open up. Yeah, show him the hole. There's the hole. Wait, right in. See that? Look at the camera screen. Look at me here. See the hole right there? Mm-hmm. Okay. All right. Later, dude. All right, it is Tuesday afternoon. We're at Sochi today. That seems I'm all over the place, which it keeps me off the streets. Or actually, no, it puts me in the streets more, doesn't it? Okay. Here's our young little Eclectus that had the carabiner stuck in his beak. Looked underneath his beak. So far, it looks good. We're gonna catch him up and look on the inside in just a second. But he's eating well. I guess back to normal completely.
Yeah.
Okay. Excellent. And so anyway, this is when we catch him up. Dude, are you ready for this? Bird wrestling match. Woohoo! And the hole is non-existent. There's a little bit of a scab still sitting there, but it looks like it's going to pop off any second now. Oh, I know. Here, turn up. Show it his boss. Anger management. Yeah. Okay, let me see. Right. I know. Okay. You've been looking that direction. Okay. Looks good. Oh, got a good close up right there. There's the scab. See it? Mm-hmm. Okay, so the good news is this guy's doing fine, provided he doesn't cover any more toys or decides not to be a punk. Somebody called him a punk online because he wanted to have piercings. He just wants to be a punk, which I thought was pretty fun. All right, we probably won't be seeing this guy again until the next time we have a problem. And when you're ready, we're here for you.